My patient has been reporting nausea today. I am going to check my MAR, and I note that the patient has ordered Reglan 10 milligrams IV push PRN nausea and has not received a dose today. I will begin by gathering my supplies. For this, I need a drug book, my medication record, or MAR, my continuous infusion record that has my IV fluids, a syringe with either a needle or a needleless device to draw from a vial. I need my medication, which is the Reglan, alcohol preps, a calculator, a pen, and patient labels. The first thing that I need to do is check to see if the Reglan IV push is compatible with the normal saline IV fluids. I've checked the drug book and it states that Reglan can be given by direct IV push and does not need to be diluted. I have also checked to see what fluids are compatible with Reglan, and those fluids include D5 water, normal saline, D5.5 normal saline, and Ringer's lactate. My patient today has normal saline running through their IV, so the Reglan will be compatible with my running IV fluids. I will now draw up my dose of Reglan. My dose is 10 milligrams IV push. The concentration on my vial is Reglan 10 milligrams per ml. I will withdraw 1 ml of Reglan from my vial. On a patient label, I will write the drug, the route, and the dose. Now I will calculate how many lines per second to push my drug. I will now look in my drug book to determine the rate. The drug book states that Reglan can be given over 1 to 2 minutes. As with any medication, I will review the nursing implications for this drug. I have 1 ml of medication. I have selected a 3 ml syringe as the appropriate size. Each ml on this 3 ml syringe has 10 lines. I want to look at the markings that have the 1/2 ml, the 1, the 1.5, the 2 mLs, not the numbers that are on the other side of the syringe. And I will be counting each one of these lines. The rate that I want to push the IV Reglan, according to the drug book, was over 1 to 2 minutes, which is 60 to 120 seconds. Here I have demonstrated a 1-minute calculation and a 2-minute calculation. The way that I set up my calculation is 60 seconds over 10 lines. 60 divided by 10 equals 6. Therefore, I will push this medication at a rate of 6 seconds per line. If I want to push this medication over 2 minutes, I will set up my problem of 120 seconds over 10 lines. 120 divided by 10 equals 12. Therefore, the rate that I will push the medication is 12 seconds per line. I have chosen to push this medication over 1 minute, and I have written on my label the calculation of 6 seconds per line. I will first gather my supplies. I need my syringe with my medication, an alcohol prep, and 2 pre-filled saline flushes. I will enter my patient's room, wash my hands, introduce myself to my patient. Then, while looking at his armband, I will ask the patient to state his name and date of birth. I will ask the patient if he has any allergies. Before administering the medication, I want to check the IV site. I see no evidence of infection, infiltration, or phlebitis at the IV site. The patient does not report any pain. I will swipe the port with alcohol. I'll attach my saline flush by twisting and then unlock the clamp. I will flush slowly and check with my patient to see if he is having any pain. I will dispose of the syringe and cap in the sharps container. Next, I will attach the Reglan to the saline lock. I am going to be looking at my watch and the markings on the syringe at the same time. I now will push this medicine at a rate of 6 seconds per line. It should take me 6 seconds of a continuous push from one line to the next. Now I will remove the syringe and place in the sharps container. Now with my second saline flush, I will attach to the port. I will flush at a rate of 6 seconds per line. Once I flush the line, I will lock it, remove the syringe, and dispose of the syringe and cap in the sharps container. I will then wash my hands. To push a medication with a patient that has a running IV line, I want to select the port that is closest to the patient, and then I would go to my IV pump and press stop or pause. I will pinch the tubing above the port. I will attach the syringe to the port and push the medication as demonstrated a moment ago.